Hey guys, this is Dr. Sandy with another exciting video for you and your family and friends. Today we're doing low back pain 101, everything related to low back. If you're watching for the first time, my name is Dr. Sandy. I am a chiropractor, been practicing now, going into my 24th year of private practice. Just have more passion to help people than ever. If you've been watching for some time, welcome back and let's jump into it. So we are going to talk about the lower back. Specifically, I have this mini model of the spine, and if we look over here, so this is called like the cervical area, so that's like your neck, the thoracic spine, which is like the mid spine, your mid back, and then if we look over here on this model, you can see the lower portion. So today's video is really based on this lower area over here, your lower back, more focused on like L1 through L5. We're just on top of the tailbone area, but anything in that zone can definitely affect the lower back. So let's kind of get into it. So first of all, this is something very common. Most people at some point in their life will have some level of back pain. So it's very common. Thankfully, I believe a lot of times people may have issues and it kind of disappears. And then you can kind of go through this scale of issues. So obviously the dream would be to have no back pain. So obviously that would be the best. And then you can have the people where I've met where they're kind of like, Dr. Sandy, I met you get back pain. It's very rare, a few times a year. It's very mild, not a big deal. I'm managing. And then as we go up that scale, if that is not addressed or taken care of, it can turn into a situation where, you know what, Dr. Sandy, it gets pretty bad, but again, now it's only 2-3 times a year, so I can manage. In between, I'm having issues, no big deal though. If I give it a couple of days of rest, I'm okay. What can happen from there is that now it's becoming more common. It might be mild, but now instead of a couple of times a year or anything, now someone might be saying, it's getting more common. It kind of went monthly. It almost seems like it's once a week now, but still, I'm pretty good. That can, from there, possibly graduate into, it's a couple of times a week, quite severe. I am getting quite concerned. It is starting to affect quality of life. It's affecting my work performance. It's harder to drive. It's harder to go to the gym. I am getting quite concerned. And then from there, it can be just really intense. And now it's a constant pain. It's always there 24/7. And that's, not a case we want to see. So a couple of comments I'm going to make. The human spinal cord, if we look at it, is a very, very powerful and essential part of the human body. For you to have great health, this needs to be healthy. They both go in hand. And what we're talking about is how the brain sends messages with nerves through this entire system. This is controlling muscle groups. This is controlling function, movement. It's controlling organ function. It is the master system. The brain is sitting here. The spinal cord is running through and it's connected to every part of the body. And it's this beautiful kind of highway system. It's getting information from the environment and sending it into the brain. The brain is getting that information, sending it to the body. And it's this beautiful symphony. It's this beautiful harmony that should be happening so you can adapt. You can maximize your function in the environment. That's the big thing I want to drive home today, is that really chiropractic is about maximizing function of this incredible system, this incredible computer that's running the whole show. And we always want to keep it optimal and healthy. When this is strong, your life is good. When this is bad, life gets very difficult, and we do not want that. So looking at that kind of situation, let's go into things that can cause back pain. So one would be obviously a trauma. So if someone obviously has a slip or a fall, that can affect it. Then you can have things like maybe over the years you've been playing sports, that can have a wear and tear effect on the body. If you have a job where you're sitting a lot, whether you drive, whether you're a professional, you use a computer quite heavily, that actually takes a toll on the spine. That can cause wear and tear and accelerate it. And then the other thing as well is that maybe there was a time where you lifted some heavy objects, where there was some heavy boxes, or maybe you guys were moving, you were helping a friend. It's not something you do all the time, but you lifted, something got shifted, you never kind of felt the same, but you're like, I think I'm okay. That should be taken care of. And why do I really stress that? Because if you look at the human body, it's very forgiving. It's always trying to, do the best with what it has. But ideally, we should be taking care of the spine proactively even before it breaks down. Just like dental hygiene, we should be taking care of our teeth before we get the cavities. But especially if we look at that scale, when something's like not a big deal, once in a while you feel it, that is also a great time to take care of it. And the reason I keep saying this, what I love about chiropractic, it's a natural way to take care of it. In chiropractic, of course, we see the need for medication, injection, and surgery. All we're saying in chiropractic is, can we go natural? Can we work on the nervous system? Can we work on the proper alignment? Get that spine as strong as possible. And then we'd like to, if possible, avoid injection, medication, or surgery. Because I think most people would agree those are very strong tools. They may help someone temporarily get through something, and I respect that. But I think most people would agree that if we look at healthcare, it should always be gentle, non-invasive. Start at that level, and then we can always go up the scale. And there is a time and place where obviously if someone had like a traumatic accident, maybe someone has just waited way too long, ignored the symptoms, thought they could push through it, and now they can't even move, they can't get out of bed. Of course, that would be an emergency situation. But I think we can all agree that natural, gentle is the way we should go. And I think that's where chiropractic really shines. So what are things that can cause someone to feel that? So if there is actually compression on those nerve roots, it can cause obviously back pain. So what happens is things are not moving correctly. The joints are getting irritated. You can almost like a friction there. The joints are grinding, which is going to cause arthritic activity. We can have the nerve compression, as I mentioned. Also, if you have a disc that's shifted, that can now push on the nerve. The muscle groups are not moving the way they should. All these things add together, and it might be, a singular issue. It might be nerve dominant, but it could be multiple issues, and it usually is that, the nerve is not, it's overfiring, or it's not working the way it should. Muscle groups, things are getting inflamed. The joint, the bones are literally rubbing each other. And also another thing, why the spine needs to be taken care of, simply the act of aging, because all of us, what are we exposed to is gravity, right? And we're using our bodies, we're moving the way we sleep. We're just active human beings. We should be. And again, that just takes a wear and tear on the body. But chiropractic proactively used to keep it in alignment, maintain the spine, can really slow down that wear and tear process. It can keep these stronger, healthier. Because what are you doing actually? So if it misaligns and you're seeing your chiropractor on a regular basis, just like a dentist, if there is an issue, you're addressing it, you're taking care of it. But if we are neglecting it, saying, yeah, it'll probably go away, I'll just rest it out or something, and it keeps showing up again and again, that's your body saying it needs help. And if we ignore those small, mild symptoms and it's not addressed, it could really just get worse and worse and intensify, and obviously no one wants that. So when it comes to managing it, and I will include a video in the link for low back exercises, I kind of again look at that spectrum. So the first thing that everyone should be doing is self-care. True healthcare, in my opinion, starts with you. You need to take care of yourself. You need to be responsible. Of course, you're going to have a supportive team around you to keep you strong, but it starts with you. So that would be things like going for walks, stretching. For a lot of people who sit all day, taking regular breaks, just taking care of the body, but stretching, and more stretching. Stretching is critical. It keeps the body healthy, specifically the spine healthy. And like I said, I'm going to include a link for low back stretches. I would recommend, if you can, stretching when you rise in the morning and just before bedtime. If you do it throughout the day, even better. And I think sometimes we can make it harder than it needs to be. I'm talking like maybe 5 minutes in the morning, 5 minutes at night. And if you can do more, fantastic, but it shouldn't be that difficult. And maybe if you're so busy, because mornings are just a big rush, got to get out, to go to work, maybe you could do it at lunchtime at work. Maybe you can do some stretches after work and before you go to bed. But those few minutes, if you can invest in yourself, will pay off. You will feel better. Not only now, as you get older, you can enjoy your life. You can go to the gym then. You can, spend time with the family. You can do better at work. Obviously, you're not missing work because of this, or just even maybe you're going to work, but you're not giving 100%. I mean, it's not a way to live, and there's things we can do to protect that. So I would definitely say the self-care. I would also say when it comes to if you are into exercise, one exercise that really sticks out to me is the deadlift. I think that's a very It's something that has to be done with extreme care. I would personally try to avoid it, do some other exercises because there's a high chance of injury. So just be mindful of that. Be mindful if you're doing any exercise and you just feel sore after. This could be someone who runs a lot. This could be someone who does an activity with a lot of jumping or bouncing. And just be mindful. Listen to your body. Your body's a fantastic computer. It's giving you constant information. So listen to that. But be mindful, especially with weights. And maybe you can do certain lifting activities like the deadlift and be safe. Listen to your body. Maybe there's a certain weight. I'm going to throw in a random number. Maybe at 50 pounds, you're doing your reps and you're great. But you notice when you do like 60, 70 and you're doing deadlifts and you're doing a lot of reps, you're just like, I don't feel good when I do it. Or how about this? You're feeling great in the gym when you do the exercise, but like the next 24, 48 hours, you're like, man, I'm sore. And I'm going to go further than that. The difference. I want you to start learning this. The difference between like a good sore and a bad sore. A good sore is like you had that workout and you're a little tender, but you're like, that felt like good. And I'm looking forward to my next workout. But if you do a workout and you're done and you're like, I'm agonizing, I'm in pain, I think I might have to take the week off, you probably went way too far. So be mindful of that. So it starts with you. You're taking care of your body. The second thing is absolutely, and I think in healthcare, I would say chiros, this is where we really shine. There's a lot of research, but low back pain, anything related to that low back, see the chiropractor. And if you're seeing the chiropractor, you should be regular. You should be maintaining it. Again, just to share with you, I do see my chiro at least weekly. When I've had challenges, I've had to go more, but I believe in a proactive lifestyle. I want to practice as long as possible. I want to be at the best shape I can be so I can care for my patients. I want to be there for my family. I want to enjoy time with my friends. I want a good quality of life, man. I am 51 and I got to take care of myself. And I like when I take care of myself, I see the fruits of that. I can enjoy myself. And I've met people, even though I'm 51, some people who are maybe in their 40s or early 50s are just like, yeah, I got to slow down, I got to take it easy. And I'm thinking like, you should be taking more care of your body. You should be enjoying yourself because, man, if you're feeling stuff in your 40s and 50s or even younger, what's going to happen in your 60s? Excuse me. I mean, it's going to be even tougher. So let's be proactive. Let's take care of it. Regular maintenance with a chiropractor. What we're doing is aligning it, taking that pressure off, keeping optimal function, keeping you at your absolute best, whatever age you are. And again, you have to remember those lower nerves over here, it's not just about back or muscles, which is definitely a part of the story. You have nerves at that area. They're going into your elimination system, overlapping with digestion, going into your bladder, going into hormonal systems, it goes into your legs. It's a very, very powerful zone. So please be aware of that, taking care of the spine. Taking care of the spine is a way to take care of the whole body, but specifically that lower portion is really just nourishing that lower area, not just muscles, but the internal organs, everything in that area are going into the legs. So we want to obviously be mindful of that. And then again, if the body is not taken care of or, extreme trauma or something happens, then it may be those medication, injection, and surgery. But like I said, while I appreciate those tools, I know they help people. Let's go gentle, let's go natural, let's go conservative before we go to that level. That should be a last resort in my opinion, because they themselves, while they're powerful tools, we know with medication, injection, and surgery, obviously there's going to be a certain risk involved. And I just think we should respect it. It should be a last resort, but we should first start with self-responsibility, self-care, work with a conservative healthcare practitioner like the chiro, and then from there, if nothing is working, those are tools. But again, in my opinion, definitely a last resort. So I'm going to leave you with a thought. I think sometimes maybe depending on the way your family raised you, your cultural background, whatever it is, there may be this feeling like, I got to really take care of everyone. I'm going to take care of everyone before I take care of myself. And I think mothers are especially guilty of this. And all I want to share with you, of course, we should be there for other people, but I want to imagine if you're like a battery, that battery's got to get recharged. And what you need to do is make time for yourself, refill, recharge that battery. And the more you actually can focus on yourself, then you can give more to others. And I know you've probably heard similar things to this, but we need to make ourselves priority number one so we can actually take care of ourselves. if you don't do this, if you are not focusing on yourself, there will come a point that you will not be able to give. You can become resentful. You're just burnt out. There's nothing to give anymore. And it may sound counterintuitive because you're like, wait a minute, we've been taught, like, care for everyone, care for everyone. And I'm 100% saying that, but I'm saying take care of yourself, honor yourself, make yourself a priority, and then you can help people. But if you're just going to help people from an empty tank, it's not going to work. And at some point, it can lead to health issues, burnouts. It doesn't make sense. So make yourself a priority so you can treat everyone around you amazing. I hope that kind of makes sense. Anyway, Dr. Sandy signing off. Wishing you only the best. Always stay healthy and strong. God bless you. And I'll be here next week with another episode. God bless you. Thanks.